as we get this up and going. Great, so we'll go ahead and get started here. Once again, thank you for joining us for our third webinar in our Vision Zero webinar series. I do want to thank our sponsors for this event, we have many sponsors throughout the year, but want a special thanks for SPIN, Bird, and Vanderbilt University who've helped us put this all together. So today our topic is all about data and how data drives decision-making in a Vision Zero framework. And so we have three speakers who I'm really excited to have join us. Whoops. Technical difficulties. But before we did get started, I wanted to just do a quick recap with some of the things we've talked about before in our previous webinars. So we are talking about Vision Zero because here in Nashville, the mayor in January committed to moving Nashville towards being a Vision Zero city to really tackle pedestrian, bicyclist, driver, roadway fatalities and serious injuries in Nashville, which unfortunately have been on the rise. And we did want to highlight the differences, once again, between the traditional road safety approach and the Vision Zero road safety approach, which is really a totally different way of thinking about traffic fatalities and safety. You can see here a couple of the main differences, but one of the really important ones is that it is a systems approach. So it's rather than spot by spot and location by location, trying to prevent collisions, it's about how do we design an entire transportation system that is safe for everybody, and particularly a system that's safe knowing that humans are flawed. We all make mistakes, and we want to make sure those mistakes are not fatal. So today we're going to be talking about how data is the key to making sure we can tackle those challenges from a systems approach. So we have three speakers here who are going to join us. First, we have Angela Berry, who is the Traffic Safety Program Manager in Charlotte. She is a PE and head of their Vision Zero, or their traffic safety program there. Next, we have Rolf Eisenger, who is currently the Vision Zero program manager in the Department of Transportation and Infrastructure in Denver, Colorado. He also formerly, I like to give him a shout out for being formerly neighbor to the north of the bike ped coordinator up in Louisville, which is where we first met him. And then last is Chris Cherry, and Chris is a professor at the University of Tennessee, Department of Civil and Environmental Engineering. And I just quick referring to my notes. His research is centered on the intersection of policy, technology, travel behavior, and safety and sustainability in the transportation sector. His past and current work spans the globe with projects in Asia and the US focusing on low impact transportation modes. Much of his work has aimed to understand the role of lightweight electrical vehicles in transportation space. He started his dissertation on e-bikes in China at UC Berkeley, and he today directs the Light Electric Vehicle Education and Research Initiative and is a PI on several ongoing projects focused on safety of vulnerable road users. So we're excited to have everybody join us today. So first up, we have Angela Berry from Charlotte, who's going to tell us a little bit about what their city is doing around traffic safety and how they integrate data. So with that, I'm going to turn it over to Angela. So if you'd like to share your screen, I'll stop sharing mine. I'll just switch here in a second. And one quick note while Angela is starting her share is we are going to have about half an hour of questions at the end. We'll have three short presentations followed by some questions from us and then opening up to all of you. If you have questions, you can go ahead and chat those in through the Q&A or the chat box, and then we'll try to get to all of those at the end. In addition, we are recording this, so if you have any colleagues who are unable to join, you're welcome to share this with them afterwards. So that, I'll turn it over to Angela.
All right. Good morning, everybody. So thank you for having me. First of all, this was definitely a bit of a surprise. I was referred by a colleague to Nora, and happy to talk to other cities about their efforts, especially here in the Southeast. So similar to Nashville, you know, in 2018, we asked the question, why Vision Zero in Charlotte? And realized that our numbers were going up on a daily basis, not daily, but on an alarming basis. And I apologize, my voice is shaking. Y'all make me a little nervous because I can't see you. So our numbers were going up, and not necessarily in a good way. And you can see that on this next slide. Our fatal injury crashes really took a jump in 2017, up to 72 fatal injuries that year, or fatal crashes, and then 82 serious injury crashes. We've since started to see a slight decline. Until I see a 5-year window of decline, that will make Angela a happy traffic safety program manager. But I think we're working in the right direction. That's the hope anyway. This pandemic has seen some increases in the first half of the year, and I'm hopeful that we level out towards the end of the year. So I wanted to just share sort of what our timeline was like for putting together our Vision Zero action plan. Our city manager came to the Department of Transportation in May and basically said, you have till the end of the year and I want an action plan. And we said, okay, that means we don't work on a whole lot of other things, but we'll do it. As you might be aware of, most cities take 12 to 24 months to do that. And I would highly recommend, if you have the ability to take 12 to 24 months, that you do that and not do this version. It makes for some very long days and very sleepless nights to try to accomplish this in 6 months if you want to accomplish it with great input from the public. So one of the very first things that we started working on was developing what's called the high injury network. And that's basically the streets where our fatal and serious injury crashes are occurring. We're on our 3rd iteration of the high injury network. We just added the 2019 data and rolled off the 2014 data. And so we're at about 9% of our total street network makes up the high injury network, which is in line with a lot of other cities. What we did in order to develop this high injury network was we reviewed and took inspiration from probably another half dozen cities beyond these 6 or 5. But these 5 really inspired some of the decisions that we made. And so I highly recommend most Vision Zero programs have everything published on their website. If they don't, there's someone like Rolf or myself who you can reach out to and get the information from them about what they did and how they did it. And I highly recommend doing that as a first step. And so what we did learn in reviewing those action plans was that nobody figures the high injury network the same way. And neither did we, to be perfectly honest with you. We kind of took a hybrid of a couple other cities' methodologies and put together what works for us. So for us, we give a weight of 1 for a vehicle serious injury crash, a weight of 3 for pike and ped crashes, and then a 5 weighting for all fatalities and all modes. And then I have a GIS expert who sums that KSI score for each link and then assigns it to the segments with a max length of a ½ mile. And then crashes at intersections are applied to each leg of the intersection. So the intersection shows the high injury network in all 3 or 4 directions. Hopefully that makes sense. And if there's questions about that, I'm probably going to have to wait and have my GIS person answer them. Since that all seemed very behind the scenes to me, I did not get into the weeds on that, let's say. We did put together a couple of interactive maps for our citizens. And in the interest of time, I'm not going to click on these links, but you might want to visit our website, which is going to be at the end, and look at the public comment map. We really took a lot of inspiration from Philadelphia as well as Denver on their public comments, and that influenced a lot of actions that we took throughout development of the action plan. Our Vision Zero Task Force, I can't say enough about this great group of people and how important they were to come together, including everybody from, local advocacy groups to our education community. Having law enforcement on board was of paramount importance to us at the beginning, and I'll explain a little bit more why that was so important to us when I get a little further in my presentation. Just to give you an idea of the depth and breadth of the organizations that were involved, everything from our local injury care prevention center to our Charlotte-Mecklenburg transportation safety organization at the schools to our state DOT as well. So really tried to run the whole breadth and depth of people who might be interested in transportation safety. In that 2-month time period where we did community engagement, myself and 2 of my colleagues attended over 25 community events, had, to the best of our recollection, over 1,000 conversations with various people about traffic safety, and we received 1,600 comments on that interactive map. So that was really great data to have in order to formulate our plan. We did things like try to meet people where they were at. And so 2 of our most successful were our open streets, where we closed down 4 to 6 miles of our streets on a Sunday afternoon. We set up a tent in a little conversation area and had a rollout map and just had some really great conversations. We had chalk for the kids so they could play while their mom and dad talked to us about safety. And then the other ones that were really successful is our city manager was relatively new to the city at the time and is very interested in meeting our citizens. And so he held a series of twice weekly, what he called meet and eats. So he actually fed folks in the community dinner and had every city department set up a table and introduce themselves to our citizens. And so he allowed Vision Zero to participate in that, and it was a really great opportunity. In terms of our data, things that we have done with it, we took that high injury network and took the segments that scored the highest and identified those as enforcement focus areas for our police department. First time we've ever done that for our police department, and it's really worked out well. I think it's given them an idea of where speeding is occurring and where traffic violations are occurring that could lead to fatal and serious injury crashes. And they managed to patrol every one of these segments in that first year that we had the enforcement focus area maps prepared. We've prioritized our streetlight upgrades based on the high injury network, so that has been really successful as well. And then the other thing that we've done, we were fortunate enough to get $48 million in CIP bonds in 2018, and every one of our programs, except for the Bryant Farms Road program, which is a very specific upgrade project, but every one of our programs now uses our high injury network data to assist in ranking their projects for funding. And so I think that's really important. It may not be the primary criteria, but it is at least a criteria that is used in the ranking of all of our projects. And so that's been a really wonderful use of our high injury network data. And so then I just wanted to share a couple lessons learned. The online map was really helpful in identifying trends in the types of concerns that our citizens had. And then also helped us because we did, you had to put in your home zip code. That was the only identifying piece of information we asked for from citizens. It helped us identify where we were lacking in community engagement. We had little business cards with the website and the map with a QR code and handed those out to folks to try to improve community engagement in those sectors where we were not seeing as much as we had hoped. We definitely recommend the longer 12 to 24 month time frame. I mentioned before how important our police force was, and I'll share just an anecdotal story. They helped us keep it really simple. We came up with a commitment statement that had the words data-driven and some more jargon type stuff in it. And one of our police officers raised his hand and he said, "It's really simple. We commit to ending traffic fatalities and serious injury crashes, period." And I was like, does everybody feel that way? And everybody said, yes, we do. And so that became our commitment statement. So they help us keep our feet on the ground and boots on the ground, if you will. The first task force meeting was really important. We brainstormed around who was in the room, who wasn't in the room, who are we missing, and what are we missing. And then lastly, just knowing your data and how it supports your Vision Zero goal is of utmost importance. So with that, I will hand it over to, I think Rolf is our next presenter. So let me stop sharing.
Great, yeah, thank you, Angela, so much. And just a reminder to everybody, please feel free to send in those questions as they come in. We'll take note of those as they come in and can discuss them after all the presentations. So next up, we have Rolf Eisenger. And Rolf, if you want to go ahead and share your screen.
All right. Let's see here, share. See if this works. Okay, all right. Good morning, everybody. Thanks for the invite. I'm excited to share how Denver has used data to develop and implement our Vision Zero action plan, but also to learn from you all on the call. So during the next 10 minutes, just gonna share with you quickly how we've used data to not only develop, implement, but evaluate our Vision Zero program. I'm going to do full screen here. There we go. All right. So just a little bit of timeline here. Denver pledged Vision Zero in 2016. To Angela's point, it can take a little while. I was still in Louisville managing their bike ped program during this time. During 2017, Denver released their Vision Zero action plan, and it had an action item in there that called out to hire a project manager. And that's where I got involved, which was late 2018. So you can kind of see the timeline from pledging, getting the funding, doing the plan, getting more funding to actually implement, and hiring the folks needed to implement. So again, the plan used crash data such as traffic fatality data, serious bodily injury data, commuting modes to highlight vulnerable roadway users and how disproportionately they're being killed as regards to mode of travel. The plan also used data to create a high entry network, which makes up about 5% of our roadways, and at the time resulted in 50% of our traffic fatalities. Something else that the plan did was we used social economic status data to develop an equity index layer. This really helps highlight exposure rate and oftentimes where there was a lack of traffic safety investment over the years, such as lack of sidewalks, lack of street lighting upgrades or traffic signal upgrades. So this really kind of helps determine where you get the biggest bang for your buck oftentimes. Our crash data is made public daily on our website using an interactive platform called Microsoft Power BI. And this is, you can log onto our website, pull open the dashboard, and it's an interactive tool that you can click on. And what we're seeing here is both fatal and serious injury data for 2020 all the way up through July. And like I said, this updates daily. So anything that happened basically yesterday should be popping up in this dashboard. And it's interactive. So you can click off the serious bodily injuries and you just get the fatalities. So we're up to 29 so far this year. You get it by month, you see by day of week, hours, they're mapped by mode. And if you want to just look at the serious bodily injuries, you can click that as well. All right, so implementing this plan goes beyond DOT, but also includes many others, as Angela had mentioned before. Here's an organizational structure. I know it's really busy, but it kind of shows how many partners and how they interact with each other, including at our executive level, our advocates, our partners, at our TAC, the Technical Advisory Committee, and also the staff at the working group levels. So lots of folks, lots of organizations helping make this work. But I gotta say, keeping up with the 67 unique action items isn't easy. So I've tried several different ways to kind of slice and dice and keep up with all the action items and leaned on this Power BI dashboard. So in the left-hand kind of widget here, you have the Vision Zero PMT, and that's basically my team that I lean on as they are accountable for keeping up with all these different action items. And I like to do it by quarterly status. So benchmarking per quarter, what are we going to get done per action item? And let's see if we did it at the end of the quarter. So being data-driven, benchmarking, and really pushing the needle. But understanding that not every one we can do. So therefore, there were about 21 that we said, hey, we're going to put these on hold for this quarter. We'll probably get to them next quarter or the quarter after. But of those in quarter two, we accomplished over 75% of them. There are 8 or 17% that we didn't get to, but we can tell our story. We have good reason for why those weren't completed. And a lot of it, I got to say, has to do with COVID and kind of the transition and budgets and legislatures not meeting. But yes, this really kind of helps dive down into those and be able to tell our story. All right, I know this is super busy, but when it comes to selecting a project, we've created this process, really a flow chart, which helps pair crash types with effective countermeasures. And this also helps us determine project phase, milestone dates, who's leading what. And if we have several inputs, including, calls from citizens, our rapid response information when a fatality or SBI, serious bodily injury occurs, our schools, community, we kind of run it through this process. But it's a great project validation, and we get approval from leadership through this process. So that comes in handy. Okay, so we can also track the status of all of our safety improvements. Now, very quickly, I can see how many projects we've completed, how many relate back to the Vision Zero action plan, such as, I don't know if you can see my cursor here, but here's the action plan and the idea, but you can see that 2.12 is continuing to build and enhance the bike network. Well, the first part of the year, we had 6 projects that related to that specific action plan. Again, you can see very quickly using this tool that we completed almost 100% of the projects we plan to complete in the first 2 quarters. There was still one that we're leaning on our transit agency to finish up projects so we could put in a geometric change at an intersection. But again, we can tell our story. We know what's going on. We know what's going on with that project and why it was delayed. The other benefit is we know delivery methods. We have kind of a look ahead in terms of which project is going where in terms of our TMC or transportation operations or contractor, street maintenance. So we can kind of give them a look ahead. Now, linking it back to the areas that I talked about, the equity index and our high injury network, we've been able to tag our projects with regards to where do they fall? Are we installing projects in the equity index area or on the high injury network, or both? So very quickly we can see, and obviously there are some that are still blank. So I can click on this slice of the pie, it'll show me exactly which projects they are, and I can go to that project manager now and say, hey, where's your project at? Let's get it in the system so we can better meet our commitments and our goals. And then speaking of the 67 unique action items, there are a few that are very infrastructure based, either those bike lanes, the sidewalks, traffic calming on corridors, signal operation improvements. So very quickly we can see in terms of our goal for the year were 2 corridor improvements. So far we've completed those 2. Unfortunately, neither of them are on the high injury network or the equity index, but I can see that we have 12 more coming up. I guess it didn't show up, but I'll have another pie chart that shows that at least 4 of those are both on the high injury network and the equity index area. So very quickly I can see across the board here how we were doing in terms of our 2020 commitments. So completing projects is hard enough, as many of you know. So thinking about evaluating can be overwhelming, but it's critical to the success of our Vision Zero program. Yes, fatalities may go up citywide, but if we can show that where we're installing projects is bringing crash rates down, then we can say Vision Zero is being achieved. Here's a location that had 40 similar single vehicle harmful events that resulted in 2 fatalities, 4 SBIs. We learned that using demographic data, 78% of the folks involved in these crashes were not Denver residents. And with a lot of coordination with CDOT, our police department, and obviously DOT, we added several safety improvements, which resulted in 2019, 0 harmful events for that single vehicle running into the barrier, 0 SPIs, and 0 fatalities in 2019, which speaks to, this is a pretty successful program or project, I should say. So thank you. I hope this was helpful. I talked pretty quick, a lot of information, but happy to take questions. So I'll hand it over to Chris next.
Great, thank you so much, Rolf. And Chris, we'll let you share your screen here as well. And I know there's a lot of detail on those slides, so afterwards, if it's all right, Rolf, I'd love to share those with everybody if they want to really dive into some of those flowcharts. All right, so next we have Chris Cherry from the University of Tennessee.
Thank you, Nora, and thank you to the other panelists. This is a great panel, and of course, really helps understand how cities can move forward here. Let me get back up to page 1 here. Okay, so my name is Chris Cherry, and I'm going to shift gears a little bit here in terms of what I do relative to the other panelists. I am a professor at the University of Tennessee. And a lot of the work that I do is related to understanding how data can inform decisions and how we can make decisions about safety that can often be political or often be either politically amplified or totally ignored. And this is one of the things that I hope that we can use research and data collection and analysis to inform in a better way. I'm going to share some examples of the work we've done, and by we, I mostly mean, for anybody who's been an academic, Nitesh Shah, my student, and Yi Wen. I think both of them are on the line if I saw on the roster. So these are my graduate students, PhD students who've been working in this area for a little bit. Let's keep going, there we go. So the idea with any sort of safety related issue is, of course, that system failures lead to injuries and deaths, and we got to address system failures. I gave a presentation to NTSB who's looking at safety of scooters recently, so I had this slide in there. I thought I'd put it on there. So if you look at the injuries from a plane crash, this is the Asiana Airlines crash that occurred in San Francisco a few years back, you would probably see hospitalizations for burns and injured feet and head injuries or whatever else. But that's only one small part of the picture, right? And NTSB focuses on big system injuries, and that ends up framing kind of how they've addressed, for example, aviation safety, which has become so safe now that issues like this, you have to look back years and years to find something like this, okay? When we think about this, then we got to think about this Vision Zero target of disabling injuries or deaths, and I'm going to use this in the context of a scooter case study. When we think about this hierarchy of injuries and then all the way down to near misses, right? These are events that didn't quite happen, but they're pretty close to being risky events. We spend a lot of time focusing on, at least in the scooter case, the bottom, or let's say the entire pyramid, not necessarily the top level pyramid. So there's been a lot of studies that have come out about injuries from scooter related crashes, and those are almost all from hospital admissions, emergency department visits, and some trauma visits. And so the key here is that we are missing kind of a big picture of what we're after. Some of the, you could say, sensational media articles that came out after some of the scooter related crashes, scooter-related studies focused on the numbers and not necessarily the modes of collision. Essentially, there's very little transportation intelligence in scooter-related crashes, and I think the same can be said for bicycles and maybe less so for pedestrians. But we don't really know a lot of the modes and so on of crash risk, especially as in a Vision Zero perspective where we're looking at injuries and deaths. So one of the things we do know, though, for example, is there have been a number of e-scooter deaths. And if you scrutinize those, which we've done, the bulk of them, over 80% of them, have been essentially caused by a car. Okay, that is, the car driver inflicted the death on the scooter rider, whereas those are not as systematically reported in injury data, for example. They're rare events, which is what we're after. So what we're looking at is well, let me just go here. So if you read any of the scooter-related crash data or studies, the big one that was the Austin CDC study, and a couple of things that came out of that one were dark time risk is high, okay? And we know that. We know that a lot of the injuries, a lot of the crashes happen in the dark, and they also raise the issue of first-time riders. But exposure, as we all know on the line, really matters here. This is data from Nashville, and I'll dive into this in the next couple of slides. This data from Nashville shows hour of day distribution of trips that are taken. And in February, of course, when you have a lot more dark hours, and in July, where you have a lot fewer, let's say, dark hours. And so if we really want to understand the role of dark hours, for example, we really need to understand this exposure variable. And I think data can start to inform that when we pair this with safety data. Same story with first-time riders. For example, a lot was made of the notion that first-time or inexperienced riders were bearing the bulk of the crashes, but we really don't know what proportion of all trips are regular riders, as you might say, or first-time riders. And so this is something that we're hoping to do also as we dig in a little more. Unfortunately, we don't have that kind of data. The companies have that kind of data, so we work with Spin, Bird, and others to try to figure out how to solve that problem. Okay. So the idea here is that data can inform these questions, and Nashville has a rich shared scooter data set, and I say shared in the both meanings of the word. It's the shared scooters, and it's also shared with researchers and others. And so the idea is that a lot of data is being collected, but there's not been as much safety-oriented research as we could have had on it. So some of the first questions that we've asked is where and why do scooters ride? Is transportation risk rather, treated similarly to so-called recreation risk? And this is a kind of a big picture question for Vision Zero as it relates to, you might say, occupational risk of transportation and the recreational risk of going on a joyride, right? And then injury data could be coupled and should be coupled with trip data. So those are the things that we're trying to do, and I'll guide you through that in the next couple minutes. So the first thing that we see, and we've seen a lot of these charts from scooter studies, but time of week and time of day and month of year patterns that we've seen scooter riders take. So one of the things that we'll notice is that scooter riders tend not to take these, let's say, early morning commutes, at least not in Nashville, and that pattern holds in a lot of cities. And then, of course, summertime and others is a good time to have scooter trips when weather's good, light is abundant, and so on. So we see these two charts here for the Nashville folks. You might think back to April 2019, what that big spike was. That was the NFL draft. Okay, so that was a huge week for scooter ridership also. But we get more inference by trying to break down the data. So trip purpose is what we're trying to really understand here. And this is some of the work that Nitesh did. And we used a bunch of clustering algorithms and principal components analysis and a lot of other jargon to break out the trips by patterns. And you can see Vanderbilt on the bottom left, Nashville in the middle, those counters. And we also paired this with origin destination data, land use data, route directness information. So the data has really good kind of route level information. I'll show you some more of that in a second. Time of day, weather, infrastructure, many other data sources that fed into this. And we can kind of see these multiple types of purposes come out. So recreation on the bottom right, I'll highlight that one. You can see the left side of that image has like a blob around a park. So these are joyriders running around the circles in the park, right? And that might have a different sort of safety approach than the daytime errand trip in the top left. These are very direct trips, short trips that go from A to B. And then the nighttime entertainment district, these are late night trips or trips that connect Vanderbilt and the honky tonks and everything else. And so all of these have different approaches to how you deal with them from a safety perspective. And then when you pair data together with them on the crash side, it might have a different approach as well. So this is some of the work we're doing, and then you can start to break out, don't try to interpret this, but we have these 5 levels of trip patterns that we see. And we want to identify how each of those interacts with the transportation system. And of course we have time of day, and then we have day of year and month of year. Of course, Vanderbilt let out in first week of May. So it turns out that a lot of our so-called day errand trips are Vanderbilt users going to class, going to restaurants, whatever else during the day. And so when the students disappeared, that dropped off kind of in a higher level than others. Okay. So add in some safety data and we end up with something like this, and you're starting to get close to what you might say is a high injury network for scooters and bicyclists. You can add pedestrians on here and have a similar type of map, and we hope to do that soon. But one of the big questions we wanted to do is look at crash data throughout the city and really identify typologies of crashes that we can focus on. The red ones are scooter crash locations. The green ones are bicycle crash locations, to see if there's different patterns that require different interventions, or whether we can treat bicycles and scooters the same. So you can see high crash roadway here on the bottom right, which is definitely a corridor of crashes that needs some intervention probably for bicyclists and scooters. And then scooters are bearing kind of the brunt of the crashes in the downtown CBD area. And then this is a heat map of actual trips. And so you can see some of the roads that don't have a high level of crashes may not have a high level of scooter trips, so we can normalize for that. So we applied this PBCAT crash typology, the new version's coming out. We relied on Tennessee's Titan crash reporting, which I'm sure most people on the line have a sense of. And it has a pretty decent classification of scooter crashes as a so-called non-motorist personal conveyance, or also some bicyclists and pedestrian. We dug into all the narratives of all of those users and found these in Nashville to make sure we're looking at the right one. There's also this interesting pedestrian on electric scooter person type that we haven't seen any data for, but it would be a nice way to tag. And this is one of the big challenges, is tagging what is a scooter. I could ask the panelists, what is a scooter? And I'd get a lot of different answers, probably. Maybe not, maybe not, who knows? Okay, so our scooter crash is different than bicycle crashes. We looked at handfuls of these, all the scooter crashes that occurred and bicycle crashes during the same period of time and the same geographic bounds, so that we're looking at the same network essentially. We dug into the full crash narratives. And I want to note that none of the drivers or passengers in any of these car to vulnerable road user crashes were injured. So this really amplifies the fact that scooter and bicyclists are really victimized by car traffic in these cases. This is a year and a half about, and it's a real challenge here, maybe close to 2 years, yeah. So what we found is that scooter and bike crashes are not very different using this methodology. We broke it down by all kinds of vehicle movements and so on. Here are some of the ones that are a little bit different. Severity is the yellow and red, fatal and injury, according to the police crash reports. And so scooter crashes occur a little bit more frequently in dark conditions on lighted streets. Bicycle crashes occur a little bit more frequently on dark, no or low lighted streets. Okay, so that's one finding that may be obvious if they're in the CBD a lot in the dark and with street lighting. Women tend to be more highly represented as a proportion of the count, crash count on scooters, and that reflects potentially higher ridership rates for women. That's kind of well documented in some of the literature or studies that scooter riders tend to be more female represented than bicycle riders. And then age, scooter riders are a little bit younger. They're in the 20s more often than bicycle riders. So this is the basic demographics of the users from the crash reports. And then from the infrastructure, intersections are so important. Take this away. 80%, and we kind of know this, but we can verify this, 80% of bicycle and scooter crashes occur at intersections. But this is an important part, okay? About a quarter of scooter intersection crashes are right turn, right approach crashes, okay? And this is about 2.5 times higher than the bicycle example or the bicycle case. And most of so this is a right turning vehicle, probably maybe a right turn on red, and then the vehicle, the scooter, comes from the right, okay? So this is the a typical case of, and I'll show you an example in a second. Bicyclists experience more car left turn conflicts where the cars fail to yield, okay? And the bicyclist is turning left. Or the car is turning left, rather, the bicyclist is going straight. So here's a common case. If I wasn't speaking into a void, I would have, if I was in a classroom, I'd have a question and answer on how to solve this. This is one where the simplistic approach would say the Lime scooter user was riding on the sidewalk, which is wrong, so therefore the Lime scooter user is to blame. But if you look at this infrastructure, the Lime scooter user is being entirely rational. There is no place for them to go north on this roadway safely. And the infrastructure is completely hostile toward anybody but car drivers. The car driver was probably turning right on red, and that's a traffic engineering tool to save a couple seconds of time for the driver, right? And so a Vision Zero scenario looks at this system and says that there's many failures here, not just one human factor failure. And so the key here is education only goes so far. Most drivers report not seeing an approaching scooter. Right turn on red is a known pedestrian, bicycle, et cetera, safety risk. And that's one of the main modes of crashes here. Disconnected one-way networks increase risky behavior. A lot of our crashes looked like this. And then intersection design really needs to increase visibility and slow turning vehicles down so that these sorts of things don't happen. So we need data, closing here, we need data for all modes, okay? Transportation system risk factors are important. Police crash provides context of injuries, hospitalization, the extent of injuries. Probe count data provides the rate of injuries, of course, and patterns of use. That's what I'm showing in the thing on the right here. And then infrastructure data provides the tools to reduce those injuries. So we can focus on these severe injuries and fatalities and zero in on them. And then minor injuries or proxies or for fatal or severe injuries or economic costs. So that's something to really focus on with bike injuries, scooter injuries, whatever else, okay? We need to improve driver and rider expectation at intersections, consider low stress networks. And then this could be, you know, this is the industry likes to, industry and agencies and others talk a lot about data. We need to require kind of better than MDS data on connected vehicles, I think. Scooters provide more data than any other mode of transportation out there, really, and it's open. And because of that, there's a little bit of scrutiny about where scooters are riding and so on. So it's not really a level playing field in that regard, but it's very powerful. This top right, 2 weekends ago, we had a Knox hackathon, and one of the scooter companies provided data to these computer science whiz kids. And in 24 hours, they were developing heat maps of where all the scooter rides were occurring in Knoxville. And so, and extending that to the trip purpose, and which ones were fun joyride trips and which ones were utilitarian trips, just by the data. So we have the tools, we have the data, we need to apply them in a kind of Vision Zero framework. So with that, I'll close, and you can contact me at any of these places, yeah, I'll turn it back over to Nora. Thank you.
Great, yeah, thanks so much, Chris. I think that's a really good, it's good to be able to see that case study, and because, like you said, we don't have that data for every mode, but since we have that data for scooters, we're hoping we can make the most of that. So I did want to, we have a couple questions here for you guys, and then we'll open it up. We've had some questions submitted from the audience, but one question I wanted to kind of ask everybody was, how do you balance the data, which is usually crash data and health report data, with the lived experience? Because very often, you know, people will have near misses or out on a street and maybe don't even feel safe enough to walk, so there are fewer crashes. So how do you balance that kind of experiences with the data that comes from crashes and is therefore very reactive? I mean, I guess we'll start with Rolf. Oh, you're muted, Rolf.
Sorry, you're cutting out. Can you repeat real quick? Or maybe Angela can start and I'll chime in.
Okay. So I take very seriously those reports of near misses. Even if the data doesn't support, historical data doesn't show that it's going on. I have several groups of citizens around the community who take a very active interest in their neighborhoods and have my direct dial number and my email and report those things to me. Usually I will take a look at the intersection and see if there, or the street, and see if there are opportunities to make improvements that might address their experience. Sometimes it can be as simple as upgrading the signals so that there's a leading pedestrian interval. And I don't manage that program, but I work very closely with the engineer who does. And so I'm able to share that anecdotal information with him and let him know that, you know, maybe this is someplace where we need to think about a leading pedestrian interval because we're reporting a lot of near miss type crashes. It's hard to balance the anecdotal information with historical data. And I think that's sort of where we're moving towards, is that systems approach. And there was a question in the chat box. That's the only one I've answered. I apologize. I was really interested in everybody else's presentations. But about taking a proactive approach to predicting potentially where crashes might occur. And a staff member and I just talked this week about him starting to work on that sort of effort. So I'm really excited by that. Hopefully we'll see some systems type approaches moving forward here in Charlotte.
Yeah, and I may just add a little bit of a different twist to that answer in terms of, yes, you know, receiving inquiries about close calls, we will look into those. They usually come in through our 3-on-1 area or our 3-on-1 system. But we want to be careful also to ensure that oftentimes those calls aren't occurring from places that are denoted in our equity index area. And I believe somebody asked a question of how do we define our equity index? And I believe I answered it. If others didn't get that answer, I can send it too. The other thing just bringing up is we work very closely with our traffic crash investigations unit. And, you know, when an SPI or a fatal happens, the next day, usually we're performing a rapid response to determine, you know, what happened, what's the appropriate countermeasure or countermeasures so that this doesn't happen again, so our officers don't have to go back out on this scene for this type of crash. But again, looking at, and that's more of a reactive approach, but again, looking at a systemic kind of model and determining, okay, these are the types of intersections that or could have this possible crash type. We're seeing this crash type happen here, here, and here. Where can we go ahead and just, for example, put in dedicated left turn arrows so that we avoid, you know, those broadside crashes that are more seriously and that result in SBIs. Thanks.
Yeah, Chris, I don't know if you were able to deal with the near misses at all from the data perspective, or is that just a kind of a black hole?
Yeah, so that is, you know, that's something that is a bit of a black hole, and to echo what Rolf said, you know, the squeaky wheel gets the grease. The empowered citizen calls in and is able to convince their city council person or mayor to leverage something, and so this is where I think data provides kind of the best, a better, maybe not the best, but a better unbiased approach to investment. And the challenge, of course, is there's really not a lot of data on near misses or other sorts of things and so for me, it would be nice to see these hotspots pop up and then have them kind of validated by the data, essentially. But again, it all comes back to reporting and other things. So.
Well, I had one question come in, which might be for Angela and Rolf. But when a hotspot is identified, how do you guys determine what intervention to use in each location? Do you have a standard process? And is that limited by funding ever?
So I would say I have a standard process, but it's all up here. It's not written down anywhere. It depends on what the nature of the crash is, obviously. You know, a side swipe pattern or a run off the road pattern is treated very differently than a pedestrian crash pattern in our central business district. So yeah, it varies based on what the nature of the crash is and what the nature of the history is. And then funding is always something to be considered. I'm sure just like Rolf and just like other cities, we have lists of projects waiting to be funded. Some of those are safety projects, not all of them, but some of them are safety projects. And we try to prioritize them based on proximity to transit, to schools, to recreational areas, whether or not they're on the high injury network, and try to weight all of those things. I have all of that written down in terms of how we weight our safety projects.
Yeah, I'd say that also working closely with your traffic investigation units, mainly because in the crash report form, there are multiple factors that are leading to resulting in a crash. A previous engineer told me, you know, usually there are at least two things that needed to happen in order to result in a really bad crash. Either somebody not watching out, somebody, you know, going too fast, or whatever it may be. But yes, really diving down into those details. But I will say, yeah, if you can lean on the crash modification factors, that's a good way to present your case for prioritization of what to fund. Though putting in a bike lane doesn't really have a great crash modification factor necessarily, right? Compared to maybe adding a sidewalk or something. So there are other metrics that need to be weighted against each other as well. So, but yeah, we try to run our projects through that cost benefit ratio, but also understanding that feasibility plays into a big role too, a big factor into this. So if you have the funding, if you can do it, you don't have to buy it right away. that can make a big difference to get that safety improvement out there quicker. Thanks.
Well, one question we also got was, are there any areas of research that could help support or address additional pain points? Is there any kind of maybe data or areas of data that are really lacking when you look at your Vision Zero efforts?
Yeah, I'd say, and I think we have the technology, but cell phone usage, like I swear when I'm riding my bike or walking or even driving, there's so many folks on their phones while driving, but when you look at the crash data, it's really hard to pull that out because people, you know, they don't want to say they're on their phone for obvious reasons. It's hard to get warrants to access the phone records to verify that they're on the phone or whatever. So I guess simple things like that, but I believe we have the technology to make it happen, but it's just, yeah. And as well as the close calls. I know there's technology out there that they're looking at using, you know, cameras on traffic signals and algorithms to determine close calls and severity of possible injuries. So that'd be also another area.
And just to chime in, I think we can, you know, we can generate this data. So for example, at TRB last year, I saw an interesting presentation where, you know, wrong way riding onto on-ramps of freeways is a problem. We know that. And we see that catastrophically when there's a crash. One researcher set up a camera at one of these spots that had reported near misses and generated just an alarming amount of people turning wrong way down that one on-ramp, right? And so that just essentially, and of course, these are the ones not reported because they realize it and turn around, right? But these simple methods it's hard to do that citywide, but these simple methods can be applied to generate that data. We can do it with single bike crashes at tricky intersections or rail crossings or other things too.
All right, well, I think we are getting pretty close to time. We do have a couple outstanding questions, which I can follow up with the panelists and send out answers to everyone who RSVP'd. But did want to give a big thank you so much to our three panelists for joining us. We really appreciate everybody taking their time, an hour or more out of their day to help us think through how Nashville should approach our Vision Zero action plan. And so we're really grateful for all of the work you guys are doing, and hopefully we can continue to partner with the other cities and other programs to learn and share what best practices are. So lastly, we did want to thank Walk Bike Nashville sponsors. This year in particular, we're very grateful to have all of our community supporters help make our work possible. So thanks to all of these folks here displayed on the screen. We will be having a recording of this presentation, so we'll have that up probably later today, as well as a quick recap. So thank you everybody for joining us. And then the last plug is we are hoping to have our next webinar at the end of next month, end of August. And the topic for that one will be enforcement. And I saw there was one question about that, but it's definitely a hot topic nationally and something Walk Bike Nashville is very interested in talking more about, and how traffic enforcement is done and maybe needs to be rethought. So stay tuned for details about that. We should have it soon, but otherwise hope everybody has a great day.
Thanks, Nora, for having us.
Yeah, thank you.
All right, thanks guys.
Yeah.